Hello, my name is John Kim, and welcome to this videocast discussing postoperative cognitive dysfunction, or POCD, in the elderly patient, and the impact benzodiazepines have on its prevalence. In today's modern world, the average lifespan continues to increase with the advances of medicine and technology. With this increase, by the year 2020, the majority of patients requiring operations will be over the age of 65. This puts an emphasis on the importance of geriatric anesthesia for nurse anesthetists worldwide. If such rates and numbers of elderly patients requiring surgery and anesthesia continue to rise in such fashion, this could mean that potentially millions of elderly patients will be at risk of developing a condition called postoperative cognitive dysfunction. In this videocast, we will discuss the definition of POCD, its presentation in the elderly patient, and the difficulty in diagnosing this condition along with the risk factors for developing POCD. We will then discuss the specific role benzodiazepines have in the prevalence of developing POCD and why the elderly patient is more susceptible to developing this condition. From there, we will discuss the importance of understanding POCD for the nurse anesthetist and the need to better recognize the risk factors in order to minimize our anesthetic footprint on this vulnerable patient population. So, what is POCD? POCD was initially recognized in 1955 and was described as adverse cerebral effects secondary to anesthesia on old people. POCD is actually a cognitive impairment that arises after surgery and is described as a change in patient's cognition with most noticeable deficits affecting a person's memory and ability to process intellectual challenges. These cognitive changes can impact the person physically and even emotionally without the affected person really knowing or understanding their current state. Such changes can last for days, weeks, to even months after their exposure to anesthesia and surgery. It is a condition that develops insidiously and can affect patients of any ages. However, it is noted that it lasts longer in people over the age of 65 and tends to have a greater impact on their day-to-day lives when faced with this condition. A clinician can rule in the development of POCD if one or more deficits are noted in a person's attention, concentration, executive function, memory function, visuospatial ability, and their psychomotor speed. POCD is a condition that is difficult to diagnose due to the required rigorous neurocognitive testing pre- and postoperatively in order to assess a person's cognitive abilities. Some of these tests used in diagnosing POCD include the Ray Auditory Verbal Learning Test, which assesses the person's ability to learn words, the Trail Making Test, which assesses the person's ability to perform multiple combined tasks, the Grooved Pegboard Test, which assesses the person's manual dexterity, and the Digital Span Test, which assesses the person's ability to remember a sequence of numbers. As you might think, these tests are difficult to complete for those with even normal cognition, let alone a person of advanced age experiencing cognitive deficits. Another difficulty in diagnosing POCD is that it is often misdiagnosed with another condition called postoperative delirium, or POD, which has a similar presentation to POCD. POD is when a patient is disoriented, thinks and speaks incoherently, and shows memory and attention deficits that is not explained by a history of dementia. It is considered a transient condition that develops in the immediate postoperative setting. In contrast, POCD is more subtle in nature, develops insidiously days and weeks after a patient's hospital course, and has the potential to last for months, which makes it important for nurse anesthetists to better recognize the risk factors that can lead to this condition. POCD risk factors fall into three categories based on the patient, the type of operation, and the mode of anesthetic delivery. Patient factors include advanced age, any pre-existing neurocognitive conditions, and a history of cardiovascular disease. Operative factors include extensive surgical procedures and surgical complications such as hemorrhage and unforeseen hospital admissions. Anesthetic factors include the use of long-acting anesthetic agents and anesthetic complications such as prolonged intraoperative hypoxia and hypoperfusion. Of the numerous factors mentioned, researchers noted three of them to be the primary predictors for POCD. These factors included increased age over 65 years, the extent of surgical trauma, and the patient's preoperative baseline level cognitive function. Anesthesia's role in the development of POCD is not completely understood to this day, and each anesthetic agent with its various pharmacologic properties can have its own unique impact on a patient's cognition. The primary focus here will be the impact benzodiazepines have on the prevalence and pathogenesis of cognitive dysfunction in elderly patients. This class of drug is widely used by nurse anesthetists, with Versed being one of the more commonly used benzodiazepines due to its safe and effective pharmacologic profile. This type of drug is used to provide mild to moderate sedation and anxiolysis for patients. Its mechanism of action is through its activity of GABA neurotransmitters on the GABA-A receptors. This action increases the chloride channel opening, which then results in neural inhibition, thus causing sedation and anxiolysis. A commonly known side effect of benzodiazepines is the impairment of new memory formation, or in many cases complete anterograde amnesia. Research has shown that benzodiazepines can contribute to the incidence of POCD in patients at risk, such as elderly patients. Benzodiazepines such as Versed inhibits the memory function through its action on the GABA-A receptor, which was stated in the previous slide. It increases the frequency of chloride channel opening, which also decreases the cholinergic activity of the hippocampus. Through this decrease in cholinergic activity, it was found that Versed impacted the acquisition stage of the memory process, which can open up at-risk patients to some form of cognitive dysfunction. Studies have shown that patients pre-medicated with Versed and then receiving a general anesthetic exhibited greater memory impairment compared to those that did not receive Versed. So what about the elderly patient make them susceptible to developing cognitive dysfunction through anesthetic agents? Factors include an elderly person's decreased muscle mass and increased body fat, which result in decreased total body water, which can affect the duration of action of some anesthetics. There is also decreased protein binding through albumin, which can increase the action of certain drugs such as benzodiazepines. The dosing of Versed is often recommended to be reduced by 50% due to its half-life being prolonged by up to 4 hours in older patients. It is commonly known that Versed and other benzodiazepines can increase the risk of postoperative delirium, which is an acute and transient episode as we learned earlier, and now we can see that it can result in more long-term cognitive dysfunction in the elderly, as seen in POCD. So, how can nurse anesthetists and other anesthesia providers minimize the risk of their elderly patients developing POCD? Anesthetists can minimize the risk by simply understanding this condition and recognizing the risk factors within each elderly patient that they might encounter. They can even find alternatives to pre-medicating their patients with benzodiazepines with other adjunct agents, or even reverting to verbal anesthesia to calm their patients before surgery. Although it is not always feasible, but decreasing the dose or even completely removing the use of benzodiazepines will be greatly beneficial to decreasing the risk of developing this condition. The importance of understanding POCD for anesthetists can be hard to grasp due to the transient nature of our patient encounters and this condition developing well outside the patient's hospital course. Despite this, it is important that we learn even the most minute detail of our anesthetic delivery, such as the use of benzodiazepines can have a dramatic long-term impact on our elderly patients postoperatively. POCD can last longer in elderly patients and impact their lives exponentially more compared to younger and more resilient patients. Cognitive dysfunction seen in this condition can lead to a decline in overall function, loss of independence, loss of personalities, and even loss of relationship, which can greatly alter a patient's life. So, the goal of this videocast is not to deter anyone from using benzodiazepines in their anesthetic. The goal is primarily to bring greater awareness to nurse anesthetists on the topic of POCD within the elderly patient population, and educate anesthetists how the use of benzodiazepines could potentially be a modifiable risk factor, which we can control, and that could potentially minimize the development of this insidious and debilitating condition postoperatively. Thank you for listening.